Typically, an infant's cardiac arrest occurs due to a breathing-related issue. Hence, the combination of breaths with compressions holds great significance for infants. The procedure for addressing an infant mirrors that for responding to a child, with the infant CPR involves specific techniques tailored for babies under the age of 1. Here's a step-by-step guide on how to administer CPR to an infant. Assess the situation. Ensure the safety of the surroundings. Tap the infant foot and shout loudly to assess responsiveness. Place the infant on a firm surface, such as a table or the ground. Activate emergency response. If the infant is unresponsive, immediately call 911 or your local emergency number. Open the airway breathing. Place the infant on their back on a firm surface. Tilt the head back slightly to open the airway. Look, listen, and feel for signs of breathing for no more than 10 seconds. If the infant is not breathing or only gasping, begin CPR. Chest compressions. Use compression to breath ratio 30:2. Use 2 fingers, index and middle finger, to compress the infant's chest just below the nipple line. Compress the chest at least 1.5 inches deep at a rate of about 100 to 120 compressions per minute. Allow the chest to fully recoil between compressions. Rescue breaths. Provide 2 rescue breaths after 30 compressions. While tilting an infant's head to open the airway, take care not to push the head too far backward, as this might obstruct the infant's air passage. To provide rescue breaths to an infant, either cover the infant's nose and mouth with your mouth, or pinch the infant's nose shut using your thumb and index finger to prevent air from escaping. Ensure a tight seal over the infant's mouth, preventing any air from escaping during the process. Continue CPR. Continue the cycle of 30 compressions and 2 rescue breaths. Continue until the infant starts breathing on their own, emergency medical personnel arrive, or you are too exhausted to continue. Use an AED if available. If an automated external defibrillator, AED, is available, follow the device's prompts for use.